So welcome everyone. My name is Jason Williams and I've got my colleague Kerry on the line with me today as well. And we're here to take you through this webinar, live QI webinar, all about running QI across your integrated care system and how to do that in live QI. First of all, just a little bit of housekeeping. Hopefully you can all see the screen that we've shared and see and hear me. There's also going to be keen to take your questions and chat throughout the course of the webinar. So if you've got any questions you would like to submit to us for us to cover, please try and use the Q&A section. But if you have any more general comments or anything you want to kind of alert us to or sort of raise, then please use the chat for that. But it's a bit easier if you put your questions into the Q&A. It just allows us to kind of work through them in order. The other thing I'd say is it's always good to know kind of who's online. So if you're happy to pop into the chat kind of who you are, which ICS perhaps you're working with or for, and where any comments on where you've got to with QI across your ICS, that would be really interesting and helpful to know. And if there's any insights there, we can always share that with the group. Just kind of useful to know as well. Okay, looks like we've got a few more people on as well, so we'll begin to get going now. I guess to start with a little bit of the background to this, kind of why we're running this webinar. So we work with NHS organisations up and down the country, and over the last probably year, maybe 18 months, there have been on and off conversations around integrated care systems and quality improvement taking place across those systems. And people often ask us, can we use live QI to do QI that's taking place across our system? And there's various different parts to that question in terms of what people want to know. We've met with customers to discuss that. And the idea of this webinar was to take some of those conversations, some of that learning, and try and present that to a wider group, basically. So we're going to cover off a number of topics and subjects that we spoke to individual customers with, and we're going to guide through the conversation using this slide that we've got up on the screen at the moment. So we've put together what we see as sort of 6 steps to ICS QI success. The kind of the topics, some of them are quite life QI specific and others aren't. So there is a bit of a general kind of process that we've seen people going through in terms of establishing how you're going to do quality improvement across your ICS. But what we're going to try and do is lace in, how to do some of that in live QI. We're certainly not here to teach you how to do QI across your ICS in terms of the method and the structure. It's more about how to facilitate some of that in live QI. I guess given the subject matter, also raised the fact that we am kind of assuming that most, if not everyone online today is from the NHS. Obviously, integrated care systems aren't restricted to the UK and the NHS, but some of the terminology, some of the language you're going to use is kind of fairly NHS specific, and assuming that although we get a lot of people from other countries online, maybe because of the time of day today, we're kind of assuming an NHS audience. But if you're not, please feel free to drop in the chat kind of where you're coming from. Or maybe try and relate some of the comments to kind of the wider sort of ICS type setup. Okay, and also I guess just on that, I assume that people know what I mean when I say ICS, integrated care system. Going to use the ICS acronym throughout most of this, just to make it a little bit easier. Okay, great. It looks like we've had at least one comment in the chat so far about someone coming in from sort of the Luton area, so that's good. And as I said, feel free to drop anything else into the chat in terms of where you're coming from, where you're at with your quality improvement across your ICS. Right, let's turn the attention to this slide. As I said, 6 steps to ICS QI success. We're going to kind of work through these now step by step, and I'm going to dive kind of into live QI and show you various bits, and then I'll kind of keep coming back to the slide as a bit of an agenda, really. So the first point we've gone here is around engaging QI stakeholders. A lot of this will be fairly, it would be done outside of live QI. Obviously, you need to understand the different stakeholders from around your system, not just in the general sense, but particularly when it comes to improvement, who's involved in improvement from the various organizations and agencies that you're working with. But once you've done that, as you begin to understand kind of the who's who and who's up to different forms of quality improvement, our suggestion, if you like, within relating that to live QI, is to set up a group in live QI, and it's a place where you can then begin to bring those people and some of that work together. So let's dive into the system and we can begin to have a bit of a look at what that would look like. So for those that are still fairly familiar with live QI, you'll kind of know about groups and know where the groups are, but for those that aren't, you've got the main menu on the left here and the group section. We recommend you go in there and create a group. The example that we're going to talk through today is we've got a made up ICS called Bay Area. And what we've done is we've set up a group called Bay Area ICS Improvement. So this is really a home to bring together potentially anything that's related to kind of system-wide improvement taking place across the Bay Area. A few things to explain here, particularly if you're not familiar with groups in LiveQI. So we've given it a name. It's got a little profile there. You can upload a logo. So whether you've got one or you want to make one that's specific to your ICS, you can have a logo in there. We can give it a bit of a description. You can see it's fairly straightforward there. Priorities, I'll kind of come back to that in a minute. We'll see those. I could bring those to life in a bit more detail in a minute. We've got a range of projects, and I'll show you how we link those in a minute. So the idea here is that there's all sorts of different bits of improvement work that are either kind of an ICS level or at least kind of suitable to be shared across the system, basically. So people can have access to those and can kind of see those and browse those. We can hold discussions. We've just got one discussion thread in here, but you can have any number of discussion threads on various kind of improvement subjects. It's up to you how many you want in there and who you invite into different discussions. But it's just trying to facilitate some of that communication, some of that dialogue across essentially the ICS working group as we've got set up here. And then over here on the right-hand side, we can see a range of faces. I'll come back to those in a second. At the bottom there, we've then got filing cabinet. So if we click on that, we'll slide that out. This is hopefully fairly obvious, but this is an area where you can upload files, create folders, organize. So you've got documents that you want to share across that kind of working group, that stakeholder set. You can stick them in here. So you can see we've got an example. We've got our QI terms of reference for our ICS that's been uploaded there. So everyone can have access to that. Everyone can see the projects. Everyone can see the improvement priorities for our ICS, those sorts of things. Now we'll talk about everyone. Let's click on the faces. I'm going to show you this side of things. So the membership of a group works in very much the same way as it does for a project or an organization in LiveQI. So if you're familiar with those, then great. But just for those that maybe aren't, I'll kind of explain it in a little bit of detail here. So we've got a mixture. We've got individual people. So these are perhaps some key characters from across our ICS who are directly involved in this work. So we've invited them as individuals to be members of this particular group. That makes sense, but we've also got a number of organizations that have been added as members. So these are the three key organizations from around our Bay Area ICS. And by giving the organizations kind of membership, we're essentially giving the people that work there access to this group and what this group has access to. So yes, these individual people have access to this group and can see these projects, but also because the organization is added, anyone at the Bay Health General Hospital who is a LiveQI user would be able to see this group and then see the projects that are linked to this. They wouldn't be able to edit them, but they would be able to see them. So this kind of overarching Bay Area ICS group is a really useful mechanism for being able to open up and kind of share projects across a fairly wide community without having to share projects with lots of individuals. You kind of link it to an organization, and that's kind of the key to sharing that. So hopefully that kind of makes sense. As I said, we've got here, it's our kind of general Bay Area ICS improvement work. So there could be all sorts of different projects, different themes, different subjects in here. And that could be helpful, but you may also want to create either instead of, or in addition to that, you might have lots of different, say, work streams or different clinical areas of focus. And it might make sense to create groups specific to each of those. You don't have to decide between, do we want work stream specific groups or do we want a general group? You can have both, and projects can exist in both. But if you're building up a bit of a portfolio of work, in this case around sepsis, then it can make sense. We also create a group for our Bay Area kind of sepsis work, basically. And then within here, we've got a number of projects related to sepsis. We can have discussion threads just amongst the stakeholder set that's relevant to this subject. Again, we can invite people and even organizations to have access to that. And again, we've got that documents area. As I said, this project could exist in multiple groups. So it could be linked here. It could be linked to our general ICS work group. It could also be linked to any internal groups within our organization as well. The group's just a useful way of being able to kind of share access to this sort of work, basically. Okay, so that's a little bit about engaging the QI stakeholders, and really what we're talking about there is how do you begin to share some of the work, provide access to things that are taking place across the ICS. The next one we'll talk about setting improvement priorities. Again, this is a fairly common subject that we get involved in with some of our customers. They're figuring out how to do improvement across their ICS. They're also figuring out, well, as a system, what are our improvement priorities? What are the collective challenges and goals that we have? Again, we're not here to help you to figure out what those are, but in terms of how you might then capture and manifest them in Live QI, that's where we can play a part. So if we go back to our Bay Area ICS improvement group, as I mentioned earlier, we've listed out some priorities. So if you have admin access to this group, you can go into the manage area and you'll be able to add priorities. So in this example, we've set 4 priorities that we say are important across the system within which we work, basically. And the idea of those is, yes, they're listed on the page and people can be made aware of those. But as much as anything, it's about them when people create projects within our ICS, they're able to link that project to any number of these priorities. So we can then have a look across the ICS and understand, okay, well, we've said improving health outcomes is important. What are we doing about that? How many projects are we running? What are those projects? How are they going? We'll have a look at that visibility and tracking piece in a minute. But a key way of being able to kickstart that process is get those priorities listed as part of your group. That could be this overarching group. You may find that they're quite specific to different clinical areas, in which case you might want to put them, or at least one of them, into one of these sorts of groups. But at the very least, if you've got this overarching group, then we'd recommend putting them in there, basically. And in a minute, we'll get into an individual project and I'll show you how you would make that linkage from project to priority, and then how that would be seen further up the chain, basically. But before we do that, I'm going to talk about agreeing a common approach. So the idea, you've got a group of people together, you've got some priority areas that you want to focus on, but part of the next step is then, okay, well, how are we actually going to work together? What's the common approach? Now, this is an interesting one because quite often you've got lots of different organizations in the ICS, and some of them might be quite established or quite mature in how they do quality improvement. They might not all be doing that in the same way. That's fairly common. What we found is that although the model for improvement and the PDSA approach to improvement is pretty common across healthcare, particularly in the NHS, it's not universal. So whilst you might find you are using a very similar or the same approach, that might not be the case. That's not necessarily a bad thing. I think from our experience of working with hundreds of NHS organisations, we don't necessarily suggest that you try and all adopt exactly the same method for everything that you run, particularly whereas a lot of that improvement work is purely internal within your trust or your organisation. But where you are working together across the system, you are bringing together people to form a single team, or multiple teams needing to share their work, then it does make sense to try and have a level of commonality across the system, basically. So yeah, don't recommend necessarily trying to change internal methods, but do try and agree or come up with some common way of working, particularly when you're working across organizational boundaries, what traditionally have been organizational boundaries. The other aspect is not just about the the method, but more about I guess the infrastructure that you then use to share this work and deliver this work, basically. So that's a bit more where Live QI comes in. Yes, Live QI is built around the model for improvement, and we'll unpack that in a bit more detail as we look at a project. But as much as anything, it provides a common infrastructure, common technology to be able to capture this place. It's one place where you can put this work. There is a single process that teams can follow. It's fairly simple, it's fairly straightforward, it's fairly accessible, basically. And also means the ease of sharing, as we've already begun to look at. If people create projects, they can link them to a group, and because of multiple organizations are linked to this group, all of a sudden I've managed to share my project across 3 organizations, and I haven't had to worry about who I've got to email it to, or where I've got to upload it, or the different systems that I've got to use for different organizations. It just provides that common place, that common home, to be able to put all of this work together, basically. The other side of that is, well, you might know better than us, but within your ICS, you might find lots of organizations already using Live QI. I think it is safe to say it's the most common QI platform, particularly within the NHS. So if people are already using it, it makes a lot of sense to just sort of broaden that use or open up that use across the organizational boundaries.
Jace, just
Yeah.
before we move on, there's just a quick question about step 2, so I thought it would be worth answering that now. So in step 2 about the priorities, is there any form or forum or way to run polls or similar within LifeQI?
Okay, there isn't a formal kind of poll type scenario, but what I would probably suggest is the discussion is probably one of the most suitable ways. Whilst it doesn't have the polling or kind of the voting type aspect to it, is kind of discussion thread type functionality. So if you were going to try and facilitate that in LifeQI, I'd probably put that out on a discussion thread and allow people to kind of comment and essentially vote through commenting on perhaps, if you've suggested 5, what are their top 3 or something like that, basically. Yeah, hopefully that's helpful. As I say, we don't have a polling function per se, but people do use that for those kind of discussions and debates and decision making, and at a level of recording decision making as well. The outcome of that would then be listed up here, but a lot of the working could be done, say, kind of within discussion. Okay, anything else, Kerry, that's popped up you want me to touch on before?
No, that's it for the minute, thank you.
Sure. Okay. So yeah, we talked briefly on agreeing a common approach. So yeah, LifeQI is this sort of ready-made solution, not just for running QI within your organization, but because it's web-based, because lots of organizations are using it, and because of some of the ease with which you can share work across organizational boundaries, it is fairly sort of tailor-made for this sort of scenario, which is why when customers have come to us saying, can we use LifeQI to work across the range of organizations, the answer is quite simply yes. That's fairly straightforward. Just tell us what you want to share and we can advise on how best to do that. Let's move on to step 4. So running projects and programs. This is where you're going to really start to get into the detail of actually doing the work and really having something to share, basically. Let's dive back into the system here. So for those that aren't that familiar with LifeQI, projects area is kind of the heart of the system. Really, this is where people spend most of their time. They're kind of in here creating projects, updating existing projects, that sort of thing. When you first click into this projects area, the default view would be your active project. So any that you're a direct team member on that are active, but you've got filters on the right-hand side, and you toggle on and off these filters, and you can click in here and see a range of more filters, and you can kind of open up and interrogate what is essentially this repository of projects that's taking place not just across your organization, but across the country and whoever has access to LifeQI. So if I click in here, I can then look at different things like different statuses, levels of progression. I can look for projects that have progressed or not progressed or been created recently. So if within my ICS, I want to, is there anyone already doing something on reducing pressure sores? I can come in, pick the relevant filters, and I can come in and then kind of use the search for existing projects, basically, and kind of use that to see, is a colleague in my organization already doing something? Is someone in my ICS already doing something? Is even someone more broadly across the country, doing something within this space? You may not have access to someone else's project, but you should at least be able to see what they're doing, and then be able to reach out to, in this case, it's Charles Bird that's running this project. I can look up Charles or start a discussion with him to try and find out a bit more information about what he's up to, and try and use that as a kind of short circuit my process, get up to speed with what I could learn from him, particularly given the level of progress that's already being shown on his project, basically. So yeah, it's not just about your projects or your organization's projects, but this is providing you a level of visibility on what's going on outside of your organization, and allowing you to share it with that audience should you wish to do so. What I'm going to do now, because there's quite a lot to get through, I'm going to keep sort of moving along. I'm going to open up a project and give you a bit of a guide through what a project looks like. Again, particularly helpful if those aren't that familiar with LifeQI. I'm not going to go through the real detail of what a project is all about. We do have separate webinars that talk about setting up projects, but just going to touch on kind of the main pages here just to give you an idea of sort of the structure, basically. So we've opened up our reducing pressure source project, and these kind of tabs, these are the pages that make up the project, basically. General page gives us some preview information. We can see kind of how populated, how progressed the project is. We've also got this score, which I mentioned briefly a second ago. This is a progress score. This was developed by the IHI, or Institute for Healthcare Improvement. So it's on every project in the system, and it's just kind of a universal scale that allows the team to record the level of progress they're making through the life cycle of the project. So it's really helpful to see this project has reached sustainable improvement. I haven't had to read through any of the details of the project. I've kind of got a bird's eye view of where it's got to in that life cycle. And then if I look across a range of projects in my ICS, I can kind of see which projects are new, which projects are quite mature, where they've got to, those sorts of things. That's really helpful to kind of just be aware of that. Some of the basics you would capture on this page are some of the charter type information. So problem, aim, rationale, team starting out the project can capture that information. They can tag it for totally sort of free form. You can add a range of different tags to the project, and you can link it to priorities as well. So going back to our group, we have a number of priorities. This is the area on the project where you would make the linkage to those priorities. And if I were to click edit over here, all of these fields have become editable. And at that point, I would then be able to add extra priorities, link it to additional priorities. As we can see, this one's linked to 2. It can be any number. You're not restricted to just one. You've then got the next few pages, which I will skip over fairly quickly, so the team can come in here and build out a driver diagrams. The idea is they would build this live on the page, and then the rest of the team, indeed the rest of the ICS, if you've shared this project, would be able to see your driver diagram, how you've color coded it, all of that sort of good stuff. Measures and charts, an area where you can come in and capture all of that data over time, whether that's run charts, whether that's control charts. Going to capture all of that information in here. If you click into one of these, you'll open up and actually have a look at the chart and where you'd add the data in. Next up, all importantly, the PDSA area. So where you're going to plan out those PDSA cycles, execute those, document those. And again, if I click into one of these, it will open up the PDSA cycle. And they're nice and straightforward templates, just kind of guiding the team through filling that out, kind of being fairly rigorous and disciplined in how they're going about kind of planning and executing these aspects of their project. And by having it in here, obviously, it's available to the rest of the team and the rest of the stakeholder set as is relevant. And then last but not least, in terms of pages, you've got the discussions area. So yeah, we had this sort of discussions on the group earlier. We're now down on our project. And just like that, you can have discussions on a project level as well. So this is useful for that project team to come together and sort of share, discuss, debate kind of what's going on. Maybe they've got some stakeholders from another organization who are kind of providing a level of coaching or something. You can come in and use these discussion threads to help facilitate some of that. And yes, you could do that through other means, through the chat on MS Teams or through email. But the idea is you're kind of keeping all of the project work, discussion, collaboration in one place, basically. So the team have got one place to come. And if anyone else in the ICS wants to kind of see what's going on with this pressure source project, they can come in here, they can see the measures, the PDSAs, they can see some of the discussion and get involved in that if that's relevant to do so. In terms of kind of the people that might have access, a bit like on the group, on the right-hand side, we've got this members area. So we can see, again, it can be a combination of kind of people, organizations and groups that have access to this. So here are the direct team members that have got access to this and play a direct role in this project. They've got different levels of permission, those sorts of things. We can see that it's being run from our Bay Health General Hospital organization. So that's the primary organization. It's also part of a training cohort there. It's also linked to the children's division of that organization. So you can see it's kind of providing links to the different groups within that organization. All importantly, it's also linked to our Bay Area ICS improvement. So we've decided that this project is part of a kind of a wider system piece of work. So we've added that group to be a member of this project. And in turn, that means this project is then shared up on that group. So if we go back up here, that's the project there, basically. So it's by adding it to the group, to my project, that it then becomes kind of visible across that group and the stakeholder set that have access to that, basically. Hopefully that makes some sense. It's fairly straightforward when you actually come in and want to add a group, invite new member. The same way you'd add a person, you can add a group, you can add an organization. And we've got help articles in the help center that would guide you through how to do that, if that would be relevant. Okay, just referring back to some of my notes. So yeah, we talked about the basic structure of a project, how to add the group to it, linking to priorities, which was on the general page. So that's an important step, and tagging the projects is one of the things. In fact, one of the tags I skipped over, but you can set up a series of tags that might be relevant to the ICS if there's certain themes or ways you want to report. I know some of the NHS England, they've got the kind of 3-tier structure. So ICS places, for example, if this project is to do with places and that level in the hierarchy, add that tag, and then you can set up a report or a dashboard that looks at how many projects have we got at the places level, on the neighborhood level, those sorts of things. That would kind of facilitate all of that, basically. Yeah, plenty more we could unpack in the detail of these, but I said other webinars will really talk to you in more detail about the project structure. What I'm going to do now is sort of take it up a level from project to program. This is another way in which you can kind of organize and run some of this work. So the idea of program kind of sit above a project in a sort of hierarchy or kind of a parent-child type scenario. So the idea, we've got a Bay Area pressure loss reduction program. Within that program, we're going to run multiple projects. Basically, we're going to run a project from within each of our organizations, and we bring that together under a single overarching program. We've opened that program up. Now, some of this structure looks very similar to the project. That's sort of intentional. So you can have a program level driver diagram and a program level set of measures and charts. But then what we do is we set up a series of different teams. So these are teams from across our different organizations, and different people have been added to those teams. Each of those teams then gets assigned a project. So we can see they've got very similar titles because it's basically the same project, but we've got one for Pioneer Hospital, one for Bay Health, one for Highlands Community. And the idea of this is, as well as just providing a home for all of this pressure ulcer work, actually the way we go about setting up the program and the projects is these projects come preloaded with the driver diagram from up here, with the measures from up here, maybe even with some PDSA cycles that you want those teams to work on. So if you've got quite a defined way that you want them to work, you've got a common aim, and also you want to aggregate some of that measurement data, then a program project structure is a really helpful way of doing that. It kind of sets those teams up nicely with what they need to work on. The teams can come in here and see each other's projects. You can go into the measurement area and see team level data, but also kind of ICS level data. So if I open up this measure, so for this particular measure, we've got data flowing in from Pioneer, Bay Health, and Greenview. If I click on each of these, it'll open up their chart, but I've also got this aggregate chart. So that's kind of team or organization level data, and this is essentially ICS level data. This chart is automatically created and automatically updated. As soon as any of these teams update their chart, this chart's going to get updated. And because it's a P chart, it's looking for the various types of special cause variation, and you can see who's been running what PDSA cycles. So Greenview team have been running that PDSA cycle, and it's potentially, looks like it might have caused a shift even at an ICS level, basically. Again, there's quite a bit more we can unpack in kind of the program area, but just to touch on that briefly, that's a really useful way of bringing together bits of work where it's a very targeted, shared aim, shared measurement strategy, that sort of thing. I'm going to pause briefly there, just check in with Kerry. Any questions, anything that's popped up there that you want me to go back over?
No, not at the moment. I think we're all fine. So continue on. Thank you.
Okay, appreciate we're covering quite a lot of ground here and moving through it quite quickly. We will share the recording afterwards, so you can kind of go back over this in slower time or share it with colleagues. But let's make the most of the time we've got. So we've touched on number 4 there, running projects and programs, and some of the key aspects of that in order to kind of share that, make some of that available across the ICS. Tracking progress and impact is next. Obviously, we're hoping that we run a whole series of very successful projects, but to be frank, whether they're successful or unsuccessful, there's still a lot of value in sharing that and the kind of educational, the learning that can come from that, basically. So a few things to look at there. One of them, I guess, just diving back into an individual project. before we look at some of the wider reporting, key aspect is making sure that teams are using the measures and charts, particularly if you're sharing a project and you want teams to be able to see the detail of what's been going on. The more that you can encourage the teams to use sort of the charts area and the PDSA area within their project, then the easier it is for others to be able to see what's going on, what did they try, what worked, maybe which PDSA cycles didn't work, and they can learn from that and perhaps avoid trying those themselves. But having that measurement data in there and those run charts or control charts is a key enabler for people really being able to understand whether you are shifting the needle in the right direction or not just for the team that's running it, but also those across the ICS. What level of impact or change are we seeing? A lot of that does come back to getting those PDSA cycles in there and that measurement data there in the run charts and control charts. Go back into this one. So we touched on that very briefly within these two. The third thing, just as a bit of a reminder, is this progress score, particularly when it comes to looking across a range of projects. A lot of the reporting at an initial level is done using these progress scores. So encouraging the teams to come in and update that and make sure that that is relevant to the stage of the project. Because if you start seeing projects that get to a 4, 4.5, 5, they're the ones that are doing really well. They're seeing good levels of improvement. You want to be able to spot those and say, okay, well, how do we take that now and how do we try and explore, how do we spread or scale that into other organizations or other parts of the system? You need to be able to spot that. Yes, the measurement data will tell you that, but you've got to dig a little bit deeper to go in and look at those charts, whereas it's quite easy to track these scores across, say, a group like this on the dashboard that we'll look at in a minute. So be able to spot, look, we've got a project that's got to 4.5 now. Let's dig into that and have a look and see what they've done. So that progress score is key. I think I've seen something popping on the chat there about, does the score update automatically? No, it doesn't, is the short answer. So it is a manual update to that score. So the team do need to come in here, click on change score, and then if you click into the different ones, you can see they've all got different titles, but they've all got set descriptions as well. And those descriptions are as per the Institute for Healthcare Improvement. They've defined all of that. But it's really up to the team to make that decision on what level of progress are we seeing, where have we got to in that life cycle, basically. Within certain organizations, you can put checks and balances in around those scores. So there might be, change the score, it might fire off a notification to the QI team, or it might even request an approval from someone within the organization before the scores change. There is some governance in place within some organizations, but the default setting is a team can come in and update that score as they see fit, basically. Okay. I want to touch on now is some of the dashboard side of things on the analytics. So we're going to talk a little bit about how you might track some of that and see evidence that things are moving. We jump now into the analytics area. This is where you have a range of different analytics dashboards. The idea of these is they are looking across a range of projects and trying to surface some key metrics and charts to give you an indication of essentially how much you're doing, what's going well, what's not going so well, so that you can kind of be informed and make relevant decisions about what you should be doing next, basically. We can help you set up these dashboards and the structure and the metrics that you want. And the idea then, as soon as you open up one of these dashboards, it's giving you essentially a real-time picture of the projects that it's looking at. So in this case, we've got one that represents everything that's taking place across our Bay Area ICS group. So opening up this page, I can see that right now we've got 5 active projects taking place across our 3 organizations. Further to that, we've got 1 completed project. Looking in a bit more detail at the progress, I can see that 5 of these projects are showing at least some level of improvement, i.e. their progress score is 3.5 or more. And then further to that, we've got 3 projects that are actually scoring a 4.5 or more. So that's great. And again, but 0 projects that have got to a 5 out of 5. So again, this is just looking at the projects that we've got within our portfolio. What are those progress scores? Have those progress scores changed? Those sorts of things. If I want to know what those 3 projects are, just click on that number 3 and it will open up a new tab with the list of those 3 projects, basically. So I haven't had to go hunting or looking for them or ringing people up to see how well their project's going. I can just come here and see, great, we've got 3 projects that are doing really, really quite well. None of them that have reached quite outstanding sustainable results, but we're still doing very well, and we should probably think about further implementation, spread and scale of these already, basically. You can also have metrics like how many projects have stalled. We would classify this as projects that have got quite a low progress score and they haven't changed that progress score in, say, 3 months or more. Thankfully, we've got a 0 here, but as soon as that turns into a 1, I don't want to click on that and figure out which project is that, what's going on there, how do we get in there early and potentially add a bit more resource, reshape that project so it can move forward. Just some example metrics, but you've got those there. This chart, not a lot of movement in this chart, but what this is showing us is month on month, a breakdown in those progress scores. So we can see that actually the portfolio has been fairly static for a while. We've got 3 projects across the board that have been at the 4.5 level of progress, and some projects were at 0.5 and at 3, but back in July, it looks like they've kind of moved up a step or 2. So we see those colours beginning to change. So a bit of movement there. Ideally, you'd want to see these colours kind of changing month on month. Otherwise, if it will all remain static, showing that the portfolio of projects has kind of become a bit static or a bit stale, basically. So just an example chart. There could be various others that you might want to include. Stuff around priorities is normally an important one. Going back to the earlier part of the conversation, as I said, we defined our 4 main priority areas. So we now want to know, okay, well, what are we doing about those? How much work are we doing? So this is telling us we've got 3 projects focusing on health outcomes, 4 on patient experience. Great, we're clearly attacking those challenges or priorities, but it looks like we're not doing anything to do with efficiencies and staff well-being. So it immediately knows we should probably be doing something about that. We've said that's a priority. It kind of allows it fairly easily to identify that we've got a bit of a gap there, basically. Again, that's just back to those projects. We've got 3 projects that basically have linked themselves to that priority. It's kind of that straightforward. In a fairly similar way, we talked about tags when we're looking at an individual project and the different kind of levels potentially within an ICS. So we've got 3 projects that have got the ICS neighborhoods tag, 3 with places and 1 with systems, so we can see the different levels, if you like, that we're working at across our ICS. That's really helpful. Maybe that's the balance we want, maybe it's not, but it's just allowing us to surface that and understand kind of at what level are we applying kind of resource, those sorts of things. And then to give us a bit more detail, in this example, we've got a project summaries table. So each project that's been shared across the ICS has got a row, so we can see we're doing pressure sores, been run by Charles Bird, when it started, the progress score, how many team members he's got, how many PDSA cycles and charts, when the last status update was and what that status update was. So it doesn't tell me everything about the project, but I can glance across that and see some of this looks fairly up to date. It looks pretty good. You can see that that's going okay. Whereas this one, 2021 was the last status update and there aren't any charts. So it looks like we need to speak to me in this case to figure out what's going on with this project. That's kind of the idea of these dashboards, is how do we surface what's going great and maybe you don't need to worry about, and what's not going so great, and maybe that's where you need to target some of the improvement resource to help sort of move that project forward, basically. So this one's looking across our ICS improvement group, so it could be everything that we've decided to share across the ICS. But if we go back to our sepsis workstream group, this is a bit more focused. This is the group, and we can also have similarly, we can have a sort of a dashboard that's focused at a particular set of projects. So this isn't the sepsis one, but this is our pressure sores sort of shared dashboard. So I can see across our ICS, we've got 10 projects that are taking place that are tackling pressure sores. Third to that, 3 are complete. And then the same structured dashboard that we just looked at, it's just that these ones are really targeting in on the pressure sores projects, basically. So those are just a few of the key ways, basically, of kind of beginning to, I guess, track some of the progress and some of the impact that you're seeing across this sort of work. And much in the same way that we did with the project and with the group, the membership of these dashboards allows you to open up to various people. So they could be specific individuals, they could be the ICS improvement group, they could be the organizations. If you want to provide everyone within the relevant organizations access, you just add those 3 organizations, and it's easy as that. These dashboards are then opened up to everyone at those respective trusts, perhaps. Okay, we're nearly at the end there. So that was tracking progress and impact, and then the last and final step in here is around sharing and celebrating, basically. Now, some of this is a bit of a just repeat or a bit of a reminder. You know, if you're going to share some of this stuff, it's about having some of it set up. So set up these groups, make sure the relevant people have got access to these groups and to these projects so that they've got visibility. It's a great thing about it being in an online system is it's fairly straightforward to share visibility of it, and that allows people to understand what's going on, what's going well, what's not going well, both through access to the projects, the groups, the dashboards, those sorts of things. So that's key. I think one of the other things is not just people having access, but making sure that you are kind of presenting and actively sharing this work. And there are various ways of doing that, but actually just presenting one of these projects or presenting one of these groups in a meeting is a very good way. As we've seen in this webinar, you know, I'm just sharing my screen, I'm taking you through a project or a series of projects. It allows people, particularly if they're not used to, they're not familiar with LiveQI, to understand what's going on. You kind of guide that. I haven't had to go and write a report on my project. I can just take you in here. I can briefly explain the problem and what we're trying to achieve. I can show you through our driver diagram briefly so you understand the logic of what we're doing. Here are our PDSA circles. This is where we've got to with our charts. You know, it's why go and write a report when all the information's here and you can easily share it over a Teams call, those sorts of things. You can even run off reports on your project. So if you do need to take a copy of this, share it ahead of a meeting, or frankly, you can also just share the link to the project. But if you do need it in a report, you can go actions and reports and run off a report on your project. Similarly with a dashboard, yes, this is live. You can share the link to this, but you can also go to actions and save this as a report, and it will PDF a copy of this dashboard. So you get a snapshot in time, basically, allows you to share what's going on. So yeah, those are some of the key ways, fairly simple, if you like, just making sure people have access to this stuff and that you are actively sharing it and presenting it, making people aware of what's going on across the ICS. And as part of that, it's about communicating you know, those successes and potentially those areas of struggle and failure, because people can learn a lot, if not more, from that often than they can from just the things that have gone very well. Okay, I think we've pretty much reached the end there. I know we've got a couple of minutes left. I've fairly rapidly run through those 6 steps. We've covered a lot of ground in the system. I hope that's been useful. Kerry, before I sort of wrap up, any final questions or comments you want me to touch on?
No, there's no more questions or comments, but just to let everyone know that I have shared a document in the chat that you might find useful, which is using LiveQI to run improvement work across ICS. So feel free to click on that link and take a look.
Excellent. Thank you very much. Well, yeah, I hope everyone enjoyed that. I hope that was useful. As I said, the idea of this, the background to this has come from conversations with mainly with trusts up and down the country. A lot of organisations are interested in working in a more joined up system-wide fashion. Frankly, a lot of them haven't really figured out how to do that yet. And so we hope that this has just been a few useful bits of information to help shape how you might do that, why you might do that. I think with all good QI, the idea is we would certainly recommend start small. It doesn't need to be some grand system-wide program or capturing everything. You know, if there's one work stream or one set of projects or one pocket of improvement that's quite common, maybe start with that. Maybe try and wrap some of this group structure around that and start sharing that. And if that works, you can grow and scale it from there. But it's just, yeah, find a good place to start and kind of build from there, basically. Would be our recommendation. I hope that's been helpful. Thank you very much. I think we're about at our 45 minutes, so we'll wrap it up there. Thank you.